Recording in progress.
The meeting is called to order. We will continue our consideration of Agenda Item 6, Post of Director General, Sub-Item 6.1, Nomination of Candidates. Having completed the initial screening in the private meeting, during which the candidate was found to meet the criteria set out by the Health Assembly in Resolution WHA 6515, we shall now proceed to the interview of the proposed candidate in a public meeting. I shall first give the floor to the representative of the Office of the Legal Counsel to provide some clarifications on this stage of the process. Dr. Granziera, you have the floor.
Thank you, Chair. Through decision EB 146/22, the Board decided that the interview will last no more than 60 minutes and will be divided between an oral presentation of no more than 20 minutes on the candidate's vision for the future priorities of the organization, with an analysis of the current problem facing it and suggestions as how those should be addressed, and a question and answer session of no more than 40 minutes. However, if there are insufficient questions to fill the allotted time, the candidate may make additional statements until the end of the period set for the interview, provided that the total time of 60 minutes is not exceeded. Thank you, Chair.
Thank you, Dr. Granziera. In addition to the modalities that were agreed by the board, I would like to propose the following additional practical modalities to conduct the interview consistent with most recent practice. My proposal was informally brought to the attention of the board members prior to the opening of the session. With respect to the oral presentation, it is proposed that the candidate may not use PowerPoint and may not distribute campaign or other materials during this presentation. The Secretariat would use a traffic light system to time the presentation by the candidate. The light would remain green for 15 minutes, then turn to amber for 5 minutes, and then turn to red at the expiration of the allotted 20 minutes, at which point I would request the candidate to terminate his presentation. With respect to the question and answer session, it is proposed that each member of the board would be given a token bearing the name of their member state. Following the presentation by the candidate, Members of the board would be invited to indicate if they would like to ask the candidate a question by placing their token in a box circulated by the Secretariat. I would then draw by lot one token and invite the member of the board's delegation concerned to put the question to the candidate in any of the 6 WHO official languages. The process would be repeated until the 40 minutes allotted for the question and answer session expires. Each member of the board whose token is drawn would be allowed 1 minute to ask a question and would only be permitted to ask one question. Members of the board would be requested not to ask questions to which the candidate has already provided an answer during his presentation or in response to a previous question. The 40 minutes period would start with a reading of the first question. Once a question has begun to be asked within the 40 minutes interval, the candidate will be allowed 3 minutes to answer the question, even if this goes beyond the 40 minutes allotted for the question and answer session. In this phase of the interview, 2 sets of traffic lights would be used. One set would time the 40 minutes duration of the question and answer session. The other set would time the 1 minute for the member of the board to ask the question and the 3 minutes for the answer to be provided by the candidate. Do any of the board members have any objections to these additional proposed modalities? I see none. It is so decided. Let us therefore proceed to the interview. I shall ask the Secretariat to accompany Dr. Tedros to the room and ask the ushers to distribute to each member of the board the token to be used in the process of selecting questions to be asked. Good morning, Dr. Tedros. I wish to thank you for coming to this interview today. I understand that the Secretariat has already informed you of the way we shall proceed this morning, and I propose that we start immediately with your oral presentation, for which you have up to 20 minutes. Dr. Tedros, you have the floor.
Thank you so much, Chair, Excellency, Chair of the Executive Board, Dr. Patrick Amott, Excellencies, dear colleagues and friends. 5 years ago, you, the member states, gave me the honor of my life when you placed your trust in me to lead and transform this vitally important global organization. I told you then that my priority was to listen, and that's what I have tried to do. I listened to you about your priorities and ideas and what you expect from your WHO. And I listened to those who know WHO best, our workforce, my colleagues, for their ideas about how to make this organization the best it can be. Those ideas became the basis of the transformation to make WHO an organization that can deliver a measurable difference to health in countries in 6 ways. By the way, I would like to share with you that I continue to listen to our staff every week on Thursdays to listen to their advice and innovative ideas. So the culture has continued. By the way, when I was Minister of Health and Minister of Foreign Affairs in Ethiopia, I used the same thing, listening on Thursdays to my staff, because listening is the basis. If you listen, then I think the next steps will be okay. And a new strategy from listening to staff and member states, a new strategy, the 13th General Program of Work, to move us from a focus on outputs to a focus on outcomes has been developed. New processes to make us more efficient and effective. A new operating model, moving from an organization that's fragmented towards one that's integrated, aligned, and agile. And a new approach to partnerships, moving from risk-averse to risk management. A new approach to financing to move us towards a more sustainable and predictable funding model. And a new culture built on a shared commitment to service, professionalism, integrity, collaboration, and compassion. That was the product of listening to member states and listening to my colleagues, my staff. Then, as you know, 2 years ago, COVID-19 changed everything. But the transformation built on the ideas and energy of our staff had positioned us to respond more rapidly and effectively than to any previous emergency. Let me take a moment to share a story from the beginning of the pandemic that really touched my heart and gave me energy and inspiration. On December 31st, 2019, New Year's Eve, as most of the world was having a party, our WHO colleagues were at work, scanning potential signals as they do 365 days a year. And that's when they saw the first signal about a cluster of cases of viral pneumonia of unknown cause from a website in Wuhan. They didn't say it could wait until the new year because it was a New Year Eve, but they acted immediately, alerting me and others. The next day, January 1st, they didn't take a holiday. They continued to work to verify the signal, and the next day, January 2nd, they confirmed it, triggering the response across the entire organization. They said, we have a new disease, which is serious. They didn't have a New Year Eve, a New Year celebration, working throughout, and me too, although I took my first holiday since I joined WHO, and I remember that I was even in Dubai, but it wasn't a holiday for them and wasn't a holiday for me. That was the first holiday in 5 years for me, and that even didn't work because of the bad news. In the days, weeks, and months since then, our staff have continued to energize, humble, and inspire me with their skill, dedication, and commitment to serving and protecting the world's people. And in the days, weeks, months, and years ahead, our staff will continue to be the eyes and ears, the arms and legs, and the beating heart of this organization. During the pandemic, health and the work of WHO have been discussed around the fire and the kitchen table, as much as around cabinet tables and boardrooms. Too often, health has been viewed as a cost. But it has never been clearer that health is an investment in the economy, society, and security. As I outlined in my speech yesterday, my vision for the next 5 years rests on 5 priorities to address the shared challenges we face. I'm sorry if I'm going to repeat what I said yesterday, but these are the same priorities based on the vision. First, a radical shift towards promoting healthy lives and well-being and preventing disease by addressing its root causes. As I said yesterday, the challenge we face is to move towards true health care, not sick care. I repeat, let's move towards true health care, not sick care. That means empowering people to take charge of their own health in the daily decisions they make. And it means working with governments to provide an enabling social, economic, and commercial environment that encourages and incentivizes people to live healthier lives. Healthier populations can cut disease burden in half, reduce the strain on health systems, increase workforce productivity, and improve lives. The best way forward is keeping our citizens and our people healthy. And there is progress to build on through the achievements we have made to eliminate trans fats, reduce tobacco use, improve nutrition and air quality, and more. Looking forward, my commitment is to strengthen strategic policy dialogue with member states using a whole-of-government approach to provide our best advice on how to make your populations healthier. I will also continue to enhance our focus on the existential challenges of the climate crisis and antimicrobial resistance. Climate change impacts our health most seriously than any other factor. Second, we must urgently reorient health systems towards primary health care at the foundation of universal health coverage. Again, there is progress to build on, including the Astana Declaration on Primary Health Care, and the political declaration on universal health coverage, which all member states endorsed at the UN General Assembly in 2019. I was very happy to have that political support from all heads of states and heads of government. However, we are now facing a shortfall of up to 840 million against our target to see 1 billion more people benefiting from universal health coverage. After decades of progress, COVID-19 led to backsliding on virtually all health indicators, and out-of-pocket health expenses are pushing millions of people back into poverty. This too is a global health emergency. We must reverse these trends, but we must also go beyond seeing health merely as a service that governments provide, but as a fundamental human right that's enshrined in the constitution of every nation on earth. I use this opportunity to ask each and every country who doesn't recognize health as a fundamental human right to do so, because health is central. And there should be a commitment by all governments to treat health as a fundamental human right in their constitution. Our new Council on the Economics of Health for All is developing recommendations around innovation-led transformation of our health systems that spur economic well-being. The new WHO Academy will provide millions of people around the world with rapid access to the highest quality learning in health. And I will expand our special program on primary health care, the glue of our triple billion goals, to provide intensive support to all low and lower middle income countries and to be active in all countries. At its heart, primary health care has a commitment to equity. Accordingly, I will enhance our focus on the least served, most marginalized populations. This must include gender equality, alongside migrants and refugees and internally displaced people, LGBTIQ+, and indigenous groups. Third, we must strengthen systems and tools for epidemic and pandemic preparedness and response at all levels. Shortly after I took office 5 years ago, we faced a dangerous Ebola outbreak in the Democratic Republic of the Congo. By the way, in the 2 years the Ebola outbreak was raging, I have been there 14 times. And 2 times, actually, I was stuck in a conflict because 17 armed groups operate in North Kivu. Very risky. Despite the difficult environment we faced, WHO and our partners applied the lessons from the West Africa Ebola outbreak and ensured a successful community-based response, integrating the delivery of new vaccines and therapeutics right to the front line. Although some people were telling us that you cannot contain it in DRC, we fought 2 years to contain it there. And I think that's a progress that you should be proud of, because it's this board that actually has decided to strengthen the emergency program. And the Ebola outbreak in DRC is a good example and done based on your guidance. The pandemic has highlighted the challenge we face, that the world was not prepared, and that the global architecture for pandemic preparedness and response is weak and still fragmented. I have focused on not only on strengthening WHO's response capacities at all levels, but also by creating a new division of preparedness within the emergencies program before even the COVID-19 hit. Through the WHO Hub for Epidemic and Pandemic Intelligence, the WHO BioHub system, and the Universal Health and Preparedness Review, we have worked with member states to put in place new initiatives to strengthen global health security, reflecting long-standing mandates from the World Health Assembly. Our new science division with a chief scientist has played a critical role working with the Emergencies Program in accelerating research and development of COVID-19 health tools. The Division of Drug Access, Vaccines and Pharmaceuticals pre-qualified 10 COVID-19 vaccines last year. The Division of Data and Delivery for Impact is helping estimate COVID-19 mortality and to develop the Universal Health and Periodic Review. And we have taken several steps towards enhancing local production of high-quality vaccines and medicines to enhance health security and universal health coverage. The decision of member states at the special session of the World Health Assembly special session to move forward on a new binding accord between nations on pandemic prevention, preparedness, and response is a giant historical stride forward. I will continue to urge leaders to act with ambition so that negotiations are swift and we are ready to respond to the inevitable next disease X. Fourth, we need to accelerate progress towards the SDGs through science and innovation, data and delivery, and digital tools. Whether we like it or not, the way forward is smart and connected. No generation in history has had more powerful tools to promote health and prevent disease, to deliver innovative health products and services in new ways, and to prepare for, prevent, detect, and respond rapidly to outbreaks and epidemics. But we also face a huge challenge to ensure equitable access to the fruits of science and innovation so they don't become another reason more people are left behind. This is the equity issue which I have been talking about for a long time. That's why strengthening data and health information system in all countries is essential to measure progress and identify gaps. I will continue to strengthen our work in science and innovation, including a greater focus on the impact of our now digitized and living guidance and the scaling of innovations to accelerate progress. And I will continue to expand our work on data and delivery, working with member states to strengthen data systems and increase capacity to identify and monitor progress. Fifth, we must strengthen WHO's leading role at the center of the global health architecture. Leadership in the global health architecture is core to the work of a Director General. Through the SDG 3 Global Action Plan, the Access to COVID-19 Tools Accelerator, and new partnerships across civil society, the private sports and technology, we're reaching people WHO has not reached before with life-saving messages. A strong WHO at the center of the global health architecture prevents fragmentation and improves value for money, not only for your investments in WHO, but in the entire global health ecosystem. As part of the transformation, we developed our first investment case, held our first partner forum, set up the WHO Foundation, increased core voluntary contributions, and introduced thematic funding. This shift has given us the flexibility to move money where it can have the most impact and to better implement the priorities member states set out in the program budget. The change we have seen in financing quality is a measure of the trust you put in WHO and has allowed us to strengthen our programs and increase funds going to regional and country offices. But the quality and quantity are still not up to the size of the task. WHO's future success will depend on your support for the proposals of the Working Group on Sustainable Financing to raise assessed contributions to 50% of our budget by 2028-2029, and to supplement our program budget process with a replenishment model. I ask you to support these recommendations. On my first day at WHO as Director General, I said our greatest asset was our staff. We have focused relentlessly on making WHO a better place to work. Going forward, we will continue to build an organization that attracts and retains the best talent from around the world. I am proud of the gender and geographic balance of my leadership team at headquarters, and I remain committed to improving gender balance and diversity at all levels of the organization. During the past year, I have been horrified by reports of sexual exploitation and abuse during the response to the Ebola outbreak in the Democratic Republic of the Congo. Maybe if you give me 1 minute, Your Excellency, I would be happy to cover just few items. I'm a bit over, but just 2 minutes.